Antimicrobial resistance, AMR, is a growing threat that weakens our ability to treat infections and safeguard lives. Across the east, central, southern regions of Africa and beyond, families, farmers, and health workers face a growing threat from this antimicrobial resistance. Infections once easily treated are now claiming lives and livelihoods, but hope lies in our collective action.
East Central and Southern Africa Health Community region currently is already witnessing a negative impact of antimicrobial resistance, from raising the costs of healthcare to treatment failure and preventable death. And this part is contributed by the misuse and overuse of antibiotics in both human and agricultural sectors. And that's the reason why the East Central and Southern East Africa community is working with its member states in formulating policies, but also developing tools and instruments to help us to counter or fight against antimicrobial resistance.
ECSA-HC's regional approach helps us share surveillance data, improve laboratory quality, and build capacity to detect and prevent infections.
So this antimicrobial resistance is actually a growing public health. In simple words, it means that medicines that once worked against bacterial infections, against fungal infections, against viral infections, are no longer effective, meaning that we don't have many options when you come down with an infection that does not respond to any available antimicrobial agent. In 2019, about 1.27 million deaths were actually attributed to bacterial infections that were resistant. And it's not just affecting public health or healthcare within hospitals and healthcare settings, but it's also in the agricultural settings, where we find misuse of antibiotics, maybe to promote growth, as growth promoters in animals, or even to try and prevent diseases in animals or infections in animals. So we are seeing a complex situation that requires multiple players to each understand what antimicrobial is, to each understand what roles they play in terms of contributing to the burden, and also to understand that they hold the solutions. So as an organization, we are engaging in multiple activities over and above what we do in the region, largely supporting the implementation of national action plans on antimicrobial resistance, because each of our member states has actually developed a national action plan to try and tackle antimicrobial resistance. So as an organization, it has been our responsibility to support the implementation of this intervention.
Every health worker trained means one more life saved and one more family protected.
Well, I admire the approach that has been used to arrive at the decision to develop a curriculum to verify what is the current knowledge on AMR, what are the skills of facilitators and lecturers in this area, what is the amount of content that is available in current syllabi on AMR and IPC. That approach brings us to the baseline of what we really need to add into the curriculum and how we need to approach teaching and learning, and to be able to strengthen the approach to address the issues of AMR and IPC.
We have challenges. There are challenges in the training of medical laboratory technologists. One, to start with, is faculty capacity challenges. You know, the healthcare landscape is evolving and changes from time to time. Different things are coming up from the researches that are being done. Different trends are coming up, and the faculty needs to be continuously updated on these new emerging trends of diseases and technologies, so that as we continue to teach these students, we are teaching them the latest. We are teaching them using the latest information, using the latest technologies that we have.
ECSA-HC has established a regional AMR technical working group, harmonized AMR surveillance tools across 9 countries, and facilitated cross-border collaboration between health, agriculture, and environment sectors.
As we all know, antimicrobial resistance is a problem that cuts across sectors. So it affects human health, animal health, environmental health. So for us to bring the One Health approach, it is important that all the stakeholders within these different sectors are represented. This is a very important piece of work that ECSA is spearheading, and I would recommend that they increase the reach to more countries.
The organization continues to advocate for sustainable funding, policy alignment, and responsible use of antibiotics.
The fight against antimicrobial resistance requires all of us, governments, professionals, and communities alike.
From clinics to parliaments, from farms to families, the fight against AMR begins with all of us. Let's act now, protect our present, and secure our future.